Hello and welcome to our very first Compass webinar of 2018. This is Eric Bricker. I am the Chief Medical Officer and one of the co-founders of Compass. And today's webinar is why healthcare navigation is essential to lowering healthcare costs. And I want to thank all of you for being here today. I see many folks that are in attendance that are existing customers of Compass and many existing broker and benefit consultant partners of Compass. I also see a lot of new names. So thank you to everybody who is new to our Compass webinars. We're super excited to have you. And there is a picture of yours truly. So a little bit about myself, and many of you already know this, but for those of you that are new, I'm a general internist. I went to medical school at the University of Illinois, did my residency training at Johns Hopkins in Baltimore, and actually did research both in medical school and in residency on the quality of diabetes care and hospital-acquired infections. And before I went into medicine, I actually used to be a hospital finance consultant because, believe it or not, docs and hospitals don't know how to get paid, so they hire outside consultants to come in and show them how to do that. And so I was working on the same complex claims issues that you as employers or brokers or benefit consultants are dealing with, but I was on the flip opposite side. I was on the doc and the hospital side of the claims. And it was a tremendous, fantastic experience, but wanted to be more clinically oriented, so went on to medical school and residency. And then one of my consulting colleagues and I, we just saw so much confusion and frustration, myself at the patient bedside, and he was seeing it in the business office of the hospital where he was working. And so he said, look, if we could take what we knew as doc and hospital insiders and bring that to companies and their employees, that would potentially be very valuable for them. And that was really the beginning or the genesis of Compass. And I also write a blog on a weekly basis that many of you subscribe to and read as well, that I've run honorable mention several times for. So that is a resource that goes back actually quite a few years as well. So just kind of what's new at Compass for 2018 for those familiar and those new. We were founded in 2005, started supporting our first client in the summer of 2007. So it's actually been over 10 years, going on 10 and a half years that we've been supporting clients. Right around 260 employees ourselves. We're located in Dallas. Those are actual Compass employees, and on that first screen, that's actually in the first floor of our building. We're in the Bank of America Plaza, which is the tallest building in downtown Dallas, on the 57th and 58th floors. And those are actual Compass employees going from left to right. It's Catherine, Art, Mary, Shavsha, and Andrew. So those are our folks. We've got about 2,000 employer clients, which we charge a PEPM. Implementation can be as short as less than 2 months for the smaller, fully insured groups, but for larger jumbo clients like T-Mobile and Southwest Airlines, which are clients of ours, implementation generally is about 3 to 6 months for them. We actually helped members navigate the healthcare system over 1.35 million times. So that's a fancy Texas way of saying this is not our first rodeo. And so you name the complex medical situation, we have probably seen it and dealt with it. And our service is used by about 25% of the employees of a group on average, which if you kind of think about the 80-20 rule where 80% of the claims are generated by 20% of the employees, then it's those folks that are going to the doc and using their benefits that use the Compass service. And that's 5 times the industry average. And it's really what we strive for at Compass because, I started Compass because I wanted it to be used, because I saw people struggling with their health insurance and navigating the healthcare system, and I wanted to be there for them as much as we possibly could. And that's why we're going to talk today about why healthcare navigation is essential to lowering healthcare costs. And for some reason, this just, let me go back here for a second. This kind of looks like Rob Lowe. I don't know why, but it looks like for some reason Rob Lowe is looking off into the distance. So we're going to talk today about healthcare navigation and how it's essential to lowering healthcare costs. So status quo today, in our opinion at Compass, can really be broken down in kind of 2 major issues. One, that employees have a healthcare hassle problem, whereas employers have a healthcare cost problem. Now notice that many employees, especially those that are on richer benefits with lower deductible PPOs or just copay plans, they may or may not be concerned about cost as much, but administratively, it is just a nightmare to navigate their health insurance and the healthcare system. And employers, well, a lot of people that work in benefits and healthcare, they don't necessarily see it as a hassle. It seems pretty smooth. They can have a pretty high touch account management experience, but the costs keep going up. So there's somewhat of a disconnect between the employee number one challenge, which is a hassle, and the employer number one challenge, which is the cost. And we're going to talk about how healthcare navigation really addresses both of those challenges. So first on the hassle problem. So many of you are familiar with this stat. 30% of medical bills are actually incorrect. And so people get more and more bills these days, and they sometimes escalate them to HR. And a lot of times those bills are incorrect, and it takes hours to resolve them. And sometimes they're of little financial consequence, maybe a $10 lab charge, or it could be literally a $25,000 bill for a cardiac cath charge. And then two, there's just lack of transparency. If people actually do need cost and quality information, it's like really hard to get that information. And especially around prescriptions, which is one of the fastest cost rising areas of an employee benefit plan, folks are overpaying and they don't really know in advance what something's going to cost them until they show up at the pharmacy, and the pharmacy tech tells them, oh, by the way, that's going to cost you $310 to fill, and get sticker shock at the pharmacy. And also a dynamic that many of you are familiar with is how those in-network healthcare prices for imaging or an endoscopy or for outpatient surgery, they can vary by 300% or more just within network. So all that stuff's kind of hidden. It's not out there and easy to get to. And a lot of employers, rightly so, say, well, isn't my insurance carrier supposed to be helping my employees and their families out with this? Well, there's a problem. Okay, and the problem is only 7% of Americans trust health insurance companies. And, right, wrong, or indifferent, it's just a fact. And that means that at your company, probably only 7% of your employees trust your health insurance company. And maybe it's because they've had a denial in the past, or they've had a hard time with customer service in the past, or maybe their expectations weren't set appropriately in terms of what their out-of-pocket costs would be, or maybe the fine print of medical policy, or maybe just the politics of Obamacare. But regardless, it's an incredibly low trust relationship. And at the end of the day, the health insurance industry is overly complex. I mean, anybody who has read through a 90-page summary plan description knows that it is overly complex. And so the health insurance industry actually ranks last in simplicity across 25 different industries. And large health insurance companies hold 3 of the bottom 5 spots. Now, per that transparency issue, and this is a dynamic that we literally have had multiple hour-long webinars about, but many of you kind of get this today, and that is that employers are overpaying for in-network care because those in-network allowed amounts, so after the insurance discount has been applied, is very different depending upon where you go. So the classic example is how like a GI endoscopy, so like an upper endoscopy or a colonoscopy, it could be $527 at one facility and $2,850 at another facility. And oh, by the way, your Dr. Anderson scopes at the endoscopy center on a Monday for $527, and he scopes at the hospital on a Tuesday for $28.50. So even if you like Dr. Anderson and you don't want to change from Dr. Anderson, there could be a huge difference in the cost. Now that's the cost in the facility fee, not the cost in Dr. Anderson's professional fee, but you can see the huge difference in that facility fee. Likewise, for high-end imaging like MRIs, one MRI facility could be $527, typically an independent imaging facility, and another like hospital-based MRI could be $1,240. Again, potentially even read by the same radiologist because they read them electronically at a centralized location. And just the facility fee for performing the MRI could be almost 2.5 times different. And so the other dynamic that is also driving that cost problem for employers, in addition to those highly disparate prices, is employers are wasting money on unnecessary care. And we really see this in employee experience in what we call the snowball effect of going to the wrong doctor to start. So this is where if somebody's having a musculoskeletal problem, they'll go to see an orthopedist, a specialist. who then orders expensive imaging that's 2 times more expensive than the area average. And then the orthopedist pursues surgery instead of a more conservative therapy. And then the surgery is performed at a facility that's 3 times more expensive than average. And then afterwards, the orthopedic surgeon prescribes a brand name medication that costs, upwards of hundreds of dollars instead of a generic medication that literally might have cost only $4 for a month's prescription. And so just the inertia of that specialist causes the cost to snowball. Now, the way to address this, and we'll get into this in more detail later on in the webinar, is not necessarily by micromanaging the medications. It's not necessarily by micromanaging the facility. It's not necessarily by micromanaging the care protocol of the surgeon. Really, it's this right here, orthopedists, where really in every other country, almost in the world, especially industrialized countries other than America, that first physician is a primary care physician. And sure, if it is overly complex and needs a specialist, by all means, use an orthopedist. But really, the use of specialists over primary care is one of the primary drivers of escalating healthcare costs because of that snowball effect that you see there. So getting into aspects of that snowball, right? So the RX spend from the medications that those specialists prescribes, plan members can save upwards of 1/3 on medications by switching to a more cost-effective and generic option. And we've seen, especially around specialty pharmacy, and with I don't want to call it shenanigans, but what's been going on with the PBMs these days, most of the groups that we've seen have seen very large RX trend over the past year. It's probably the highest trending bucket within all of their services, upwards of it accounts for about 25 to 30% of a group's overall medical spend, and it's been trending anywhere from 15 to 35, 40% for groups. And then we see at Compass that only about 37% of plan members do not have an established relationship with a PCP. We can see that as high as double that with some groups, where 2/3 of the employees do not have an established relationship with a PCP. So it's not only the unit cost of the actual prices and the need for price transparency, but it's also the number of units as dictated by using specialty care over primary care. So what is that common solution? That common solution is to empower employees to make simpler, smarter healthcare decisions. Now, what do we mean by that? We're going to solve the employee hassle problem by eliminating the headache of health insurance and healthcare. Make it simpler for employees to get the answers and care they need so they can focus on the right things that matter most to them. So your employees and their family members are not health insurance experts. They're not healthcare experts. They cannot frankly expected to become health insurance experts. And also, to solve the employer cost problem, no one can anticipate a healthcare catastrophe or an undiagnosed health condition, but employers can reduce their health plan risk by getting employees to the right doctor from the start. And so health navigation involves simpler, smarter healthcare decisions. It's really rooted in those decisions. And what you need to keep in mind about those decisions is those decisions need expertise. They need competence. And there is a variety of ways and places that competence and that expertise can come from. And we're going to go through those through this, the rest of this discussion. So specifically around healthcare navigation helps employees make simpler, smarter healthcare decisions, okay? So notice here that we're saying simpler, smarter healthcare decisions related to their health insurance, decisions related to navigating the healthcare system, but we're not saying simpler, smarter medical decisions. So we don't expect an employee to be an expert around the pathogenesis of amyloidosis. We don't expect an employee to be an expert on the signs and symptoms of chronic inflammatory demyelinating polyneuropathy, or CIDP, right? I mean, that's the whole reason why people need to see a healthcare professional or a physician, but it is around understanding their health insurance and understanding navigating the healthcare system. And if that can be done effectively, then we can actually eliminate the healthcare hassle and really optimize your network for the highest quality, cost-effective care. So that's the end goal that we're achieving with health navigation, is to eliminate the healthcare hassle for employees and really optimize your network with high quality, cost-effective care. Okay, so what we're going to do now is go into more detail around factors to consider when selecting a healthcare navigation solution. So these circles or tiles here are specifically designed to address the healthcare consumer or patient pain points as they are navigating their health insurance and their healthcare. And what's important is that it's really both. It's both their health insurance and their healthcare, because their health insurance company might have a lot of expertise about health insurance, but at the end of the day, they really don't understand much about healthcare itself. And I can tell you firsthand as a physician that people who work in healthcare know very little about how health insurance actually works. So they don't have that expertise. So it's really a combining or an overlapping of the two. It involves, first and foremost, understanding health plan benefits, your medical, your dental, your prescription, your vision coverage. It's about finding physicians that meet the specific requirements of your employees and their families that are high quality and cost effective. It's about putting your employees in touch with the many great programs that you have at the right time, whether it be disease management or a smoking cessation program or telemedicine. You have many wonderful programs, but many of them are underused. So it's about getting those, it's about identifying those teachable moments and getting your employees into those programs at the right time. And then once people start using their benefits and start using the healthcare system, the left hand oftentimes is not talking to the right. One of the best examples that I've seen of this is, many of you have probably read the biography of Steve Jobs. And Steve Jobs, when he was dealing with his cancer, he actually, even at one of the best hospitals in the country, his care was not coordinated amongst all of his different specialists. And if Steve Jobs has a hard time with this, I guarantee you that all of your employees that are having healthcare problems are also having a hard time with this. So many of them are suffering in silence, but there is a real lack of coordination. And then there's comparing cost for the actual procedures and care. Excuse me, had to sneeze there. And this is where, notice that when we're talking about comparing costs, many people think about, okay, well, you know, employees are just going to shop for healthcare and they're going to say, okay, well, you know, I'd like to see 3 different comparative costs for an MRI, lumbar spine, CPT code 72148 in my particular zip code. And the point is that that's not how navigating healthcare starts for employees. The percentage of employees that actually start navigating healthcare with that specific quote unquote shopping question in mind is actually very low. And what happens is they actually kind of start back here. They're like, you know, is this covered? How do my benefits work? You know, I don't even know if I have a deductible or not. I don't know what it is. I'm not even sure who my insurance carrier is. I mean, it can be that rudimentary. And then they're trying to find a doctor and trying to find out which parts of their benefits actually will apply to this particular situation. So just know that it's important to address these tiles, because they then lead into that actual shopping or cost comparison experience. So it's not that the cost comparison experience doesn't work or that it can't be done, but it's almost like you have to warm up to it. And then of course, when somebody goes to the doctor, oftentimes they're prescribed a medication. And so that's where the prescription assistance is so important. And then at the end of the day, especially, you know, someone might have a medical emergency. So they might bypass all this stuff and they might have a real emergency, broken bone, they're bleeding, crushing chest pain and shortness of breath. Maybe they didn't go through all this rigmarole beforehand, but they end up getting a bill for $100, $750, $25,000. I literally was speaking to an insurance broker that we partner with yesterday, and he and his family went skiing in Colorado over the winter holidays, and his wife got altitude sickness. And if anyone on this call has had altitude sickness, I personally have, it feels awful. And they went to the emergency room and their bills have already started coming in and have already actually totaled over $20,000 for an ER visit for altitude sickness, if you can imagine that. And so, again, this is an employee benefits broker. This is somebody who has incredible understanding and acumen and expertise around this. And frankly, at Compass, we actually have a lot of insurance broker clients. So just know that is a very common challenge that folks are having as they're navigating healthcare. Okay, so what are the components necessary? So we kind of talked about at the micro level, what are the different tiles or services that are needed? But those services have to be delivered in a certain manner. So in other words, like if you were trying to, use a bow and arrow to go out hunting, it's like, okay, you got to have a good bow and you got to have a good arrow, but you have to use them in the right way in order to, successfully, catch your prey. And so what does that entail? That entails, one, concierge support. And what that means is that the information comes from a trusted and competent source. And those are the two key words, trusted and competent. It's like if you're in a fire, everyone's like, okay, you're going to trust the firemen to like help get you out of the burning building. Why? Because they're trusted and competent. And then two, the information that they give you needs to be smart. In other words, it needs to be like relevant and applicable to you. It needs to be the right information. And then lastly, it needs to be in the moment. And what that means is that it needs to be at the right time. It's kind of like humor and comedy, where timing is everything. Where if it's way too early or if it's way too late, then that timing, if that timing is wrong, then even if it comes from a trusted source and even if it has the right information, it's still not going to be effective. Let me give you an example of too early timing. Information during open enrollment. Well, maybe they're not having a medical issue during open enrollment, so that's not the right time for it to happen. What's a time when it's too late? Maybe it's after the service has already occurred. And there are many things that could have been prevented upstream, but because all of this has already transpired, it's too late. So getting the timing right is super important. Okay, so let's talk about that first, trust and competency in that person. And so really, because healthcare at the end of the day is very emotional and it's very complex, one, it's very important to have human-to-human interaction. So that concierge model is important to sort of cut through the emotionality of a medical situation. And it's important to listen, and then it's important to then understand, and then it's important to be able to synthesize, and then it's important to be able to communicate, and then it's important to take action. And the skill set required in order to do that is actually pretty sophisticated. So these people need to be pretty sophisticated and, have a lot of mental horsepower to be able to do this. And so it's important that these people are hired appropriately. And, frankly, at the end of the day, all of us on this call work in employee benefits, and we know how complicated it is. And so we all know that you have to have a lot of mental horsepower to do this, and you require a lot of training. But even with having the right, sort of protoplasm and the right training, you still need to have the right software tools and technology and data and analytics. So having that person to be trusted and competent and achieving that competence through hiring and training and tools is super important. And that's where this concierge model, of course, I'm going to advocate for a third-party concierge model because we oftentimes see that with a traditional health plan model, that it is one to that third slide, it's not trusted. And so even if this person from the health plan was the most brilliant person on the planet, just kind of who they're associated with and who they're coming from, at the end of the day, again, right, wrong, or indifferent, because only 7% of Americans trust the health insurance industry, that person is probably not going to be trusted. Okay. And then two, historically, they are limited to only what they cover. So if they're doing the medical, but that carrier is not doing the dental or the vision, or they're not doing all those other ancillary programs like the wellness or the diabetes management, then you don't solve that fragmentation problem. And oftentimes, instead of having a highly skilled person, they're using a very low wage person who is using scripts and they're having to escalate to supervisors when something more complex is asked. And frankly, from an efficiency standpoint, they are not necessarily incentivized to do a lot of escalation. And so therefore, it's really transactional. It's based on a lot of call times and being able to get people off the phone. And at the end of the day, they are evaluated on the number of calls that they have handled. So that is a call center culture and a call center tradition that essentially, if you have a third party that does this, you're starting from scratch, and you can begin with a new paradigm, a paradigm that's comprehensive across all of your benefits, medical, dental, vision, RX, and all your other ancillary health benefits. A foundation of problem solving, critical thinking folks that are four-year college graduates that actually exceed expectations. So a culture of not a transaction, but a culture of solutions, a culture of your priority that's personal, long-term, trusted. Again, because healthcare is so emotional, to actually have a longitudinal relationship with the same person or the same small team of people can be highly effective. And then lastly, a culture of a support team that's evaluated on quality and member satisfaction and dollars saved, both in terms of the employees' out-of-pocket costs and the plan's overall cost. That's really a culture of outcomes. So not a culture of calls, not a culture of time to get off the phone, but really a culture of outcomes. Now, so you've got that trusted, competent person that is navigating your employees and their families through the healthcare system. Two, the information they give them has to be smart recommendations. And what do we mean by smart recommendations? Is that specifically as it relates to finding providers, whether it be physicians or nurse practitioners or physician's assistants or urgent care facilities or physical therapists or occupational therapists or psychiatrists or psychologists, that not all of those providers are created equal, that some are better than others. In fact, there was a very good article recently written where physicians were in denial that a bell-shaped curve exists. Imagine that. As a physician, I can tell you myself that many of my colleagues are in denial that a bell-shaped curve exists. But of course a bell-shaped curve exists when it comes to physicians and physical therapists and anybody who works in the healthcare profession. And so what does a bell-shaped curve have? It has an upper half and it has a lower half. And both of those halves are probably in your network. And so which half of the bell-shaped curve do you want your employees to go to? Well, obviously you want them to go to the more high quality, cost-effective half of the bell-shaped curve. Now, oftentimes the health plan has their hands tied because they are actually oftentimes contractually bound to not do in-network steerage, because that's one of the clauses for why they are able to give discounts to these large health systems is that they promise that they will not steer people away from them. And even across a large health system, not everybody in that large health system is somebody that you're going to want to go to. Right? There's a bell-shaped curve across providers within that health system. So you really want smart recommendations that are tailored to your employee's specific need around location, appointment availability, expertise, potentially the number of procedures that they had performed in the past in terms of their experience. And so you want to combine that employee's health plan information with personal preferences. And you want to simplify decision-making by having all the options down to a few distinct recommendations and making it easy for employees to then take actions on that. So it's really providing the right information, and again, at the right time. And so we've got our trusted, competent source of information, we've got the right information, and then it's like, okay, it's got to be at the right time. So the in-the-moment guidance means that we want to empower employees with the right information at the right time to improve healthcare decision-making, reduce unnecessary care, and lower healthcare costs, and to really help employees understand and use their health benefits like telemedicine, disease management, EAP, in the moment when they actually need it. I'll give you one story about that. And it actually relates to frankly, the opioid crisis in America is one of the most literally on a weekly basis, sometimes multiple times a week, we get contacted by members who are either themselves looking for a treatment addiction center, or they're looking for a treatment addiction center for someone in their immediate family. And so in terms of like their benefits and how they cover, so treatment centers are, the coverage for that is very tricky. Sometimes it's covered, sometimes it's not covered. Some facilities are in network, some facilities are out of network. Some facilities take insurance, other facilities don't take insurance. And this is somewhat of a crisis situation, and it's a very emotional situation. And so having that information, now are people going to pay attention to this type of information during open enrollment? No, probably not. If it's already, too late, and somebody's addiction has caused them to be in the hospital with a health problem, then that's also too late. And so really at the time when either the person is seeking the help or the family is able to intervene and get that person help, that is when, and when it happens, it's beautiful. I mean, we literally have members and family members of our members who have gotten to the facility, found a spot that's open, found one that is covered, found one that takes their insurance, found one that's in network. And then we keep up with the number of quote unquote approved days that are needed while they're in that facility. And then upon discharge, they often, almost require continued counseling and therapy, and oftentimes medication treatment on top of that. And all the coverage related to that, and providers and practitioners that are skilled in that are incredibly hard to come by. And you can recover. Our members recover, their family members recover. There are probably people on this call that have family members or friends that have gone through a similar experience. And so the timing of being able to have that trusted, competent source deliver that right information at the right time, because if you get the timing wrong on that, and that's an extreme example, I know that, but it could be related to labor and delivery. It could be related to imaging. It could be related to chronic low back pain. Getting that at the right time is super important. And this slide is meant to point out how, that health navigation solution is not meant to boil the ocean. It's not meant to be all things to all people, because certainly there are fantastic vendors and carriers and programs that have tons of expertise in their particular niche. But of course, the point is that not all of your employees need every single one of these vendors every day, right? They need them certain people need these certain services at certain times, whether it be telemedicine or wellness or second opinion or maternity programs or EAP or diabetes management or tobacco cessation or metabolic syndrome programs or special physical therapy, musculoskeletal programs. And we've seen that to be able to have employees navigate not only their health insurance, not only the healthcare system, but all these fantastic ancillary point solution vendors allows those people to get the help they need at the time they need it. It's like having an Uber dashboard, if you will, with an expert right there holding your hand to get them into the right program at the right time. So let's just take a specific employee example to see how this health navigation would work at the individual microcosmic level. So here, an employee suffers a knee injury while jogging. We have many of our Compass members are in Colorado and in Washington State. I mean, this could be literally one of our Compass members, trying to be healthy, exercising, maybe being compliant with their company wellness program, and as a result, they end up having a knee injury. Maybe it was a cartilaginous injury, maybe it was a pulled ACL. There's a variety of common musculoskeletal challenges that a person could have, right? So fine. So what would happen without Compass and without healthcare navigation? Well, they'd be unable to wait that 2 weeks for a local PCP. They called up their local PCP. Oh, you got to wait 2 weeks? No, my knee's hurting. I can't wait the 2 weeks. So the employee schedules an appointment at an orthopedic surgeon because their neighbor, Sally, told them about this orthopedic surgeon. Okay. The surgeon immediately orders an x-ray and a costly MRI of the knee at a nearby hospital. So that visit for the orthopedic surgeon and the x-ray, $230. The employee receives the MRI, $1,475, and then the surgeon recommends a knee specialist. So they went to an orthopedist who was not even an expert in the particular type of injury that they had. So they then need to go see another orthopedist. And that knee specialist suggests that, that surgery is needed. And the employee schedules the surgery at the same hospital. Doesn't look around for choices, doesn't look for a second opinion, doesn't look to see if it's in or out of network, doesn't see how it's covered. And then after the surgery, the employee needs physical therapy post-surgery. And if they go to and they just, the orthopedist gives them a piece of paper with like 5 or 6 different PT clinics on it. They pick the one that's the closest to their house. You walk into the physical therapy clinic and they do an evaluation, and guess how many times they say you need to be there? 16. The magic number is 16 for physical therapy. Why is that? Because 16 visits per diagnosis or per episode is the maximum allowable, typically by Medicare or by the private insurance. So what does that mean? With many physical therapists, when you walk in, no matter what, you're going to get recommended for 16 visits, regardless of what you have. That may or may not be the right thing for you. And then the orthopedist writes a prescription for Duexis. Do you know what Duexis is? It's a combination pill of ibuprofen and Pepcid. Now, it's prescription strength ibuprofen, but the Pepcid you can get over the counter. And guess what? That Duexis, just for a 90-day supply, literally costs $2,100. And I kid you not, my wife was actually prescribed this by an orthopedic surgeon. This is real. She actually had this experience. She did not end up filling it. We did something alternative to that. So what would happen in a healthcare navigation experience? Okay, they use their healthcare navigation concierge. They find a PCP that's in network, that's high quality, that's cost effective, and has appointment availability. The doctor performs an X-ray in the office and discussions options to the employee. And the reason for doing an X-ray is just to make sure there's not a fracture. You can't see soft tissue on an X-ray. So is there cartilaginous damage? Is there some type of ACL injury? That is actually determined by the physical exam and by the history. And so what happens is that the employee visits a local, highly regarded physical therapy clinic. Again, that's recommended by their healthcare navigation service. What they do in physical therapy is they teach you exercises that you then need to repeat, oftentimes daily, at home. You don't need to come in 16 times for that. You can oftentimes learn and get coaching on those exercises in about 4 sessions. So the physical therapy is $320. And even if you can go to the Choosing Wisely campaign, for many conditions, what's called watchful waiting is very appropriate. And many musculoskeletal issues, whether it be acute low back pain or other issues, oftentimes resolve on their own with pain medication, muscle relaxants, and physical therapy over the course of 2 to 4 weeks without the need for the surgery. And the doc writes a prescription for 800 milligrams of ibuprofen, which is prescription strength ibuprofen, and suggests using Pepcid over the counter. And the reason is I'm sure many of you know, is that the ibuprofen can cause stomach upset, and the Pepcid is an acid suppressant in the stomach to try to decrease that stomach upset. So at the end of the day, by using health navigation, that knee injury from running could cost $560 instead of $15,000. Okay, so let's go through then a checklist of what you would want to keep in mind as you're thinking about navigation solutions. So again, we want to go back to, okay, I know that our employees are having a healthcare hassle problem with their insurance and with navigating the healthcare system. So it needs to be comprehensive, right? There's a lot of moving parts. It needs to cover all those parts, the medical, dental, the vision, the RX, and the ancillary benefits. It needs to cover bills. It needs to cover understanding those bills and correcting those bills if they're wrong. And it also needs to involve coordinating care, not only among the various specialists, but also amongst your various vendors, and then actually getting them in the door with scheduling. And again, to deal with that emotionality of healthcare experiences, it really needs to have a personal touch. It needs to have a concierge model to it. And that's all fine and good, and we love helping employees, and that's the right thing to do, and everybody on this call knows that. But at the end of the day, we need to take cost out of the healthcare budget of our employers or of our clients. And so we need to provide smart recommendations to do that. So we need to provide the right information that's based on quality and cost and availability and personal preference, and that curates all options into a few distinct recommendations so that it's easy to take action. We don't want to overwhelm people with a website that gives you like every single specialist starting with the letter A, because alphabetical is probably not the right way to organize that information, right? The person's last name has nothing to do with if they're high quality or cost effective, right? So it needs to provide that smart recommendation or that personalized information. It needs to be at the right time, and then it needs to provide flexible connections to other health benefit programs such as care management and wellness. So I see so much, I don't want to call it waste, because I will say that there are forces at work that are intentionally driving up healthcare costs for your employees, their families, and for you. And I see that ourselves. I mean, Compass ourselves, we were on a self-funded plan, and I see our employees go and essentially be taken advantage of. And of course, our employees at Compass are lucky because they have the expertise. We even have our own health pro at Compass for our own employees. Her name's Dawnette. And I have personally used her. Our CEO has used her. Many of our health pros and our IT people and our client success people use her. And I can tell you that not only has it been invaluable because, just like everybody else on this call, I'm busy, but two, it saved our family personally a lot of money, and our healthcare costs specifically at Compass are exceedingly low. And I can tell you about time and time again of our own Compass employees that have used, their own expertise or their Compass Health Pro, where if they had not done that, then they would have been taken advantage of in a way that could have been prevented. And repeat that story for T-Mobile and Southwest Airlines and NTT Data and Nebraska Furniture Mart. I mean, you name it. I mean, we literally have members in Alaska and Florida and everywhere in between. And it's just made me feel good as just doing the right thing. If you see somebody suffering and you can do something about it, it just gives me a lot of satisfaction. And so for all of our clients that are on the phone, I just want to thank you for providing that support for your employees. I mean, at the end of the day, and we know it because our health pros are involved in helping these employees, that there are employees who don't necessarily come to you in HR. They don't necessarily come to the executives, but there are, frankly, horror stories where we have helped employees, with literally 57 bills over a 3-month period of time that they would have been bankrupt. They would have been bankrupt if it had not been for having that type of service. So oftentimes you do hear these stories, but many times they go unnoticed. And not only is it helping them, but it's helping your plan and their performance. And I just want to briefly say here at the end that the way that Compass delivers that health navigation is through a combination of technology and our health pros. And if you think about it, that's kind of how we navigate other aspects of our life, right? If you're going to buy a house, you're probably going to use your smartphone and you're going to use a realtor. If you're going to use a bank, you're probably going to use your smartphone bank app, and you're probably going to go to the bank and use the bank people occasionally. And if you are saving for retirement, you're probably going to use some sort of financial app, and you're probably going to have some type of advisor. And so just navigating healthcare also falls into that natural mix of technology and people. And obviously Compass only works if people use it. And so we're very excited for a very segmented and totally new series of campaigns that we call Health Pro Tips that go out to all of our clients and their employees to educate them about how to be a better healthcare consumer and how Compass can help you do that, whether it's around prescriptions, whether it's about navigating their network to avoid overpaying for services, whether it involves complex medical bills. And again, these are pictures of actual health pros here. We actually don't use stock photos. Maybe occasionally we do, but the vast majority of time we don't. And that curriculum that literally from manufacturing companies to highly paid entertainment law firms in Los Angeles use our service to and it's not about turning the employees into healthcare experts. It's about giving them access to that expertise. And as a result, what happens? $1,158 of savings per user, 25 times better care experience as measured by Net Promoter Score of the physicians that Compass recommends versus if they were to find physicians on their own. Guidance when they need it most, so it actually is in the moment guidance. And what does that translate into? Into a 7 times better benefits experience, again, as measured by Net Promoter Score of the actual Compass members who used our service when they were navigating healthcare. And so to that end, I want to bring our first Compass webinar of the year to a close. I want to do a couple of things. I want to say, one, that we have a Navigating Healthcare blog that you can see here at compassphs.com/blog. And I do also want to tell you to email me at ericb@compassphs.com if you would like a copy of these slides. I'm more than happy to share these. We've PDF'd them so that they're easy to share. But if you would like a copy of today's slides, please email me. And then know that we have our previous month's webinars on our website at compassphs.com/webinars. And this webinar will also be available on our website in the coming days, so that if you want to go back or share it with your colleagues or what have you, then you'll be able to do that. I've seen some questions come up. So for those folks that have asked those questions, let me address those. And there's obviously a question box. If you'd like to ask some questions, then feel free to do that as well. So some folks are asking for follow-up information that involves pricing information for Compass, and we'd be happy to do that. So again, email me at ericb@compassphs.com for that. So this is a really good question here. Thank you for asking this. So do you think that due to HDHPs, employees are skipping the cost of a PCP who is going to refer to a specialist? Why not just go to the right doctor who is going to help? So that's a great question, and it's part of the screening that we do. This is probably another topic for another webinar. But when we find and match people with primary care physicians, we can actually look at the referral patterns of PCPs based upon their claims history. Again, we have billions of claims that our analytics sift through. And so you can tell which PCPs almost like refer appropriately versus inappropriately. And you can tell based upon sort of the ratio of referrals to visits that they have, where there are some PCPs that just refer, and they actually add pretty little value. Whereas there's other PCPs that actually act like that patient-centered medical home model, where they actually have like in-office imaging, in-office lab. They have nurse practitioners and physician's assistants that offer same-day appointments. They have diabetes educators, and they really take care of that whole person. Because I can tell you at Johns Hopkins, when they trained us at internists, that you can take care of the vast majority of a person's care needs in the primary care physician's office, but not just any primary care physician's office. And that's where that screening in terms of their referral patterns, and then really that structure of their entire office as a group office setting with ancillary services and multiple providers in the same office to take care of that employee as a home. So anyway, that's a long-winded way to say, if you go to any old PCP, that refer might be your experience. But if you can get in with a PCP that can treat you in that medical home environment, then it not only affects the unit cost, but also the overall units of utilization. And it's really, I mean, even though I'm a physician myself, I actually go to a primary care physician that is set up that way, because at the end of the day, nobody can be objective about their own health. You kind of need another set of eyes to look at you, and frankly, I'm highly appreciative of that experience. So thank you for that question. This next question relates to what people are seeing in some situations as what's referred to as reference-based pricing or Medicare plus-based pricing, where some groups will say, hey, they get rid of the network, they get rid of the carrier, they only use a TPA, and they say, hey, we're going to reimburse at Medicare plus 20% or 120% for XYZ service. And so in those types of situations, essentially you don't have variability of price because you're going to reimburse that Medicare plus 120% no matter what. But the challenge that we've seen in those types of plans is one, not all health systems and not all providers play. And it depends upon is it a big town or is it a small town? It depends upon the part of the country. But we've actually had, in Dallas, we actually have a lot of experience with employers that use that type of setup. And I can tell you there's a major healthcare system in Dallas that has like 18 hospitals that does not play. And so to be able to act as the concierge and hold employees' hands, and the hard thing is that it's not always obvious when you're going to see one of those physicians, because again, what it says on the front of the office or the front of the clinic does not necessarily correlate with what the tax ID is in the back. And then on top of that, even if the quote unquote health system does play, to say that the bill is quote unquote written off and the member is not balance billed every time, like in our experience, that like doesn't happen. And so it's kind of messy. And so people, it's like, oh yeah, I forgot, or no, I'm not, I might have said I was going to do that, but now I'm not going to go by that anymore. And so what happens is that the employee signs a piece of paper when they go into that hospital that's standard for everybody that says, I am ultimately financially responsible for this service. And so they get sent to collections, and they get angry phone calls. And I'm being a little melodramatic here, but the point is that the vast majority of groups have not gone in that direction. To stop short of going in that direction, you can use a healthcare navigation service like Compass to provide the price transparency to really essentially create to maximize your network. You can almost find the providers that kind of charge 120% of Medicare within your existing network. So you can just kind of like maximize your existing network. For folks that do end up wanting to go the Medicare cost plus direction, hey, and I will tell you in our own experience and with the experience of the brokers that use it a lot, it tends to work with companies that have high turnover employee groups. So a lot of restaurant business, some manufacturing, nursing homes, that low turnover businesses we have not seen be as successful. I'm not saying it can't be done. Those low turnover businesses tend to not be as successful with the cost plus model as with businesses that have very high turnover. I mean, some of these businesses have like 80% employee turnover. And so because they're churning through employees so quickly, then that cost plus model, you know what, it makes sense for them. Again, probably another webinar for another day. So thank you for asking that question. I apologize for being long-winded in the answer to that. And then next question, and I'll just make this the last one. I think there's a few others, so if I haven't been able to answer your question, I apologize for that. What are some things that can be done to increase engagement if engagement is lower than what you desire? That's a great question. So so we have the health pros that are helping the employees and their families, and then we have account management at Compass that we call client success. And we basically have a menu of best practices that we've seen used across different companies, because again, we've been doing this for 10 years. And we've learned that not all engagement practices work with all companies. There's no one size fits all solution. And so that's why we've created this menu, and we say, okay, for you, and we literally have this big grid of checkboxes, and we say, okay, for you, which ones of these checkboxes apply? Now, it can be electronic, it can be hard copy, it can be things done through home, it can be things done through a benefit portal. It can be emailing out those monthly hints. It can be through sending those hints to HR and HR sending those out. It can be through a online registration process where we're actually sending those hints to the spouses at home, because it's not the employees that are driving the healthcare spend, it's the spouses that are driving the healthcare spend. And so engaging those spouses is actually the most important thing. It could be through generating those hints on a monthly basis hard copy in break room signage or in flat screen TV signage in various manufacturing facilities. So it could, if you have it could be incorporating Compass as part of the employee onboarding process. It could be incorporating Compass as part of the open enrollment requirements that employees have to do during an active open enrollment. You get the point. What we would do is we would go through that checklist, and we have literally seen, whether it be like Michael's or Motel 6, where we've seen these employers that have had 6, 7, 8, 9, 10% utilization rates increase them to 20, 30, 40, 50% utilization rates by using a multi-pronged approach over time to increase that approach. So again, probably more of an answer than you wanted. So I apologize for being long-winded, but I will end there. And again, I will put up my email address if you'd like to email me for the slides. And I really want to thank you for giving me the most important thing you have, which is your time and attention. And so look forward to future webinars. We do these on a monthly basis, typically on the last or the second to last Tuesday of the month. And so with that, I hope all of you have a great rest of your Tuesday and a great rest of your week. Bye now.